Hi, quick update from the Beaver Health and Medicines Committee meeting that was held on the 6th of October. We updated ourselves on collaborative projects that we've got going with the RCVS and rumour around antimicrobial use. Those projects are progressing nicely, so more meetings coming up on that. We talked around World Antimicrobial Awareness Week, which is coming up towards the latter end of November, and our plans for that. Bruce and Victoria are leading on that, so there's going to be a number of communiques coming out through that week, and then a discussion forum at the end of the week just discussing antimicrobial stewardship, focusing on some of the new data that Bruce has primarily generated with support from others on council and the wider equine community. So that will be good to see. Talked about updates to the website, and that's not particularly exciting to share. We had updates from Beaver's Infectious Diseases Working Group, which CDMR chairs, and ran through their plans for developing more Beaver guidance notes, which is great to see. They've got some ambitious targets for the documents they're going to produce, so that's fantastic. Similarly, updates from the British Equestrian Federation Infectious Diseases Advisory Group on their new guidelines for venues for equestrian gatherings and competitions. We've gone through those as a committee and gone back to that group with some minor suggested changes, but that's another really exciting piece of work that will primarily benefit the equestrian community, but will clearly help in our efforts to control infectious disease. So that's fantastic. A big thing that came out of the board meeting last week was the decision to co-opt onto Health and Medicines Committee some representatives from Wales and Northern Ireland, given that there are unique situations, particularly in Northern Ireland, around medicines use. So if you are practicing, or not necessarily practicing, but if you're based in Wales or Northern Ireland and you would be interested in joining Beaver's Health and Medicines Committee to act as a liaison with those areas, then please see e-news and put yourselves forward for that position. So yeah, it'd be great to have you involved if you're keen to work with us on those topics. Finally, we had an update on the flu situation. I won't go into any great detail because there's other communications about that, but obviously great news that there's vaccine coming in from the US, although that will pose some challenges given that it's a combined flu herpes vaccine. So we had a bit of discussion around that, and there will be more information to follow on that. So thanks for listening. That was a brief update on what we're up to. There will clearly be more to follow.